discretion is advised.
We rolling. We rolling. Hi, guys. Let's get this lighting right. Hold on. Okay. Hi. I think I'm gonna go with her. Hey, y'all. Okay. She's cute. The light. And me, but we ain't gonna talk about that. We got so much more to talk about. Hi, guys. Y'all, welcome to my channel. If you're confused about why I'm holding a fan up to my face, we gonna get into that later. But right now, let me adjust her because she is one of the most important things in my life at the moment. We'll talk about that. Trust me. We're gonna get into all of it. Right now, though, I just want to welcome you here to my channel. Guys, thank you so much for tuning in. If you are my IG fam, Facebook fam, TikTok fam, and you found your way to YouTube, thank you, thank you, thank you. You know, what that says to me is that you care about my journey, you care about what's going on with me, and I am revealing it here on YouTube. So, you know, if you are here, hit that like button. Hit that subscribe button so we can stay in contact. And if you do know me, you know I love to say connect the dots, which I consider everybody that loves and supports me my dots. Of course, my name is Dottie. It's a play on words, but it's also so important that I stay connected to those who love me and who I love. And this is just another dot in our connection, okay? So thank you again for being here. I love y'all. Now let's dive right onto it. Into it, not onto it. So what is it, Dottie? Come on, girl. Spit it out. Let's go. Okay. It's endometriosis, guys. A severe and aggressive form of endometriosis. All right. That is a disease of the uterus. I also have been diagnosed with adenomyosis, but we'll get into that later on. First, we're going to deal with Miss Ma'am, Lil Mama. Endometriosis. Okay? She's something else. And I totally believe that this disease deserves so much more attention than it gets because it is far more serious than people know. And that's what I want to talk about today. So can we get into it? Can we get into it? All right, let's do that. I have been dealing with endometriosis for years, and it was misdiagnosed and untreated, which led me to be in stage 4 endometriosis. And what stage 4 endometriosis means is that I have lesions very deep within my muscles and that my endometriosis has essentially left my pelvic cavity. Y'all, and the complications, the things, the issues, the problems. Before we get into all that, though, let's just focus on exactly what endometriosis is, okay? Let's throw it up on the screen. Well, according to VeracitySelfCare.com, endometriosis is a condition rooted in the reproductive system, but it can have wide-ranging effects that impact the endocrine or hormonal system, immune system, and digestive tract. Its name comes from the word endometrium, which is the tissue regularly found inside of the lining of the uterus. During a healthy menstrual cycle, endometrial tissue goes through its own phases of growth and shedding, the latter of which is responsible for the bleeding that happens during your regular period. In women with endometriosis, this tissue is found in locations outside of the uterus, including the abdomen, ovaries, bladder, or intestines. Because this tissue naturally responds to the hormonal shifts throughout a menstrual cycle, it can begin to grow or shed wherever it is located, which can cause severe pain, bleeding, scar tissue, and other medical problems. Well, like many women, I went through life from 11 years old to now thinking I just had a really bad period. I had gone to doctors for all types of symptoms that I now know are related to endometriosis, with no help. Essentially, I was just told that, you know, you have a rough period, it's hard, take this medicine, do this, but none of those things helped me. I knew in my heart that something was going on with me that was bigger and more serious than doctors were taking it, and I just knew that I needed to be persistent with what I was telling them and let them know that, like, yo, y'all got to figure this out. This is not just a hard period. This is not just, you know, I'm dealing with a lot of other things. You know what I mean? So I think right now I want to talk about the symptoms. What led me to this point? Let's put up some symptoms of endometriosis. All right, so right before you is from WorcesterHospital.org, where they give you a couple of symptoms from endometriosis or early endometriosis, okay? And I just want to inform you that these are only a few. We're going to dive into some later, but these are only a few. They're early signs of endometriosis, okay? They include severe, debilitating abdominal cramps, pelvic pain, usually worse during the period, long periods, heavy menstrual flow, nausea and or vomiting, pain, cramping during or after sexual intercourse, bowel and urinary disorders, painful bowel movements or urination during menstruation, infertility, and chronic fatigue. Again, these are a few symptoms of early endometriosis, and, you know, these are essentially what led me to say, hey, I gotta seek some help. All right, so due to the lack of advocacy within our community, I just feel compelled to speak up because my disease did not have to get this advanced. But because we are not listened to, because our pain is not taken serious, because, you know, studies have shown that nurses and doctors do not feel like we are telling the truth when we speak about our experiences, it has led many women to the point that I am. You know what I mean? Which does not have to be. Don't let them tell you nothing is wrong with you. Don't let them send you home with another prescription of pain meds, not getting to the bottom of what's going on with you. Ladies, you deserve more. Black women, you deserve more. Now, endometriosis does affect all women, different races, creeds, religion. Hey, it hits you. If you are of menstruating age, if you are of childbearing age, you are at risk for endometriosis. If you have a history of endometriosis in your family, you are more at risk. I just want to talk to you for a second about talking to your doctors, being very clear and concise with what's going on with you. Black women, tune in, baby. This is for you. I got some statistics. Throw them up. All right, so according to Healthline.com, Black people are less likely to get our endometriosis diagnosed. Wow. So it says, I've heard countless stories about the fight to get an endo diagnosis. It's sometimes dismissed as nothing more than a bad period. Yeah, y'all heard that from me earlier, right? Laparoscopic surgery is the only way to definitively diagnose endometriosis, but cost and a lack of doctors who are willing or able to perform the surgery can get in the way. People can begin experiencing symptoms as early as their preteen years, but it takes an average of 8 to 12 years, y'all. Y'all hear that? Y'all hear that? An average of 8 to 12 years of suffering, Lord. Jeez. Between your first feeling the symptoms and getting a diagnosis. My God, today. Okay? So when I say that Black patients have an even more difficult time getting a diagnosis, you know it must be bad. Researchers have done fewer studies on endometriosis among African Americans, so even when symptoms show up the same way as for white patients, doctors misdiagnose the cause more often. Ain't that a... Now, because pain is the #1 symptom of endometriosis, it's even harder for us as Black women, African American women, to be diagnosed. Because again, as I said before, our pain is not taken serious, okay? It's often misread as being overreactive, okay? And I could just smack the hell out of anybody think you overreacting. You got endometriosis, okay? According to Healthline.com, endometriosis can overlap with other conditions that Black people are more likely to have. All right, so listen up. Endometriosis doesn't just show up in isolation from other health conditions. If a person has other diseases, then endo comes along for the ride. All right, when you consider the other health conditions that disproportionately affect Black women, you can see how this might play out. Take other aspects of reproductive health, for instance, uterine fibroids. Lord, I didn't say that right. Uterine fibroids. There we go. Which are non-cancerous tumors in the uterus that can cause heavy bleeding, pain, problems with urination, and miscarriage. And African American women are 3 times more likely than other women to get this, all right? Black women are also at a higher risk for heart disease, strokes, and diabetes, which often occur together and can have life-threatening results. Also, mental health issues like depression and anxiety can hit black women especially hard. I mean, come on, look what we deal with, right? It can be difficult to find culturally competent care, to deal with the stigma of mental illness, and to carry the stereotype of being the strong black woman along the way. These conditions may seem unrelated to endometriosis, but when a black woman faces a higher risk for these conditions, plus a smaller chance of an accurate diagnosis, she's vulnerable to being left struggling with her health without proper care. How do we get them to truly know if we have endometriosis? Even after we advocate for ourselves, after we tell our symptoms, how do we find out? Well, you find a healthcare specialist, a gynecologist that, God, I could get emotional, sorry, that does not think you're just crapping them around. You find you someone who's listening at the fact that you feel like you're dying each month. That every time you come on your cycle, you can't handle it. You're sick. You're tired. You are in so much pain that you feel nuts, crazy. You are bleeding so heavily. You're like a slaughtered pig. Okay? It's too much. You can't work. It's affecting your romantic life, your family life, your creative life. The thing you have to know about endometriosis is it just doesn't affect you when your cycle comes. It begins to be an everyday thing. Every day you're waking up with symptoms of endometriosis, because even if you're not on your cycle, those growths, those lesions, they're inflamed by things you eat, by your environment, by your lifestyle. So it's an everyday, all day thing, especially when it gets to those end stages. And you have to find you a doctor that listens. I found me a doctor that listened. His name is Dr. Michael Stack. I love him so very much.
I do. It's so good.
I'm feeling shy and embarrassed now.
I love you, Dr.
Well,
Stack.
I love you too. I'm glad we're getting some things taken care of.
I know.
Get you back to exactly where you need to be.
Thank you.
Are we gonna go ahead and crank this up?
Yeah.
Oh, I love this. Oh,
Isn't it pretty?
it is so pretty. I'm gonna just carry it around with me. This is awesome. Y'all are the best.
Well, you're the best. Thank you so much for everything.
I'm here for you, and we're gonna try to fix things, and we'll skirt around however we need to.
That's right.
This man was heaven sent. And once I went into him, he said, you know what? We've got to do the only thing I know to do, and that's go on the inside. No more talking about it. No more imagining what it is, kind of thinking what it is. Nah, we're going to find out what it is. So I had laparoscopic surgery. Let's talk about what that is. All right, so you may ask, why laparoscopic surgery, right? According to WebMD.com, even though you have symptoms of endometriosis, the only way for your doctor to diagnose it is by performing a laparoscopy. All right, so you'll get general anesthesia, meaning you won't be awake. During the procedure, your surgeon will make a small incision near your belly button and fill your abdomen with gas to get a better look at your internal organs. Next, they'll insert a laparoscope, which is a thin tube with a video camera to look for scarring on your uterus, ovaries, fallopian tubes, bladder, and other organs. Your surgeon can remove any endometriosis scarring and lesions during the laparoscopy as well. Depending on how much endometriosis the surgeon has to remove, the procedure can last anywhere from 30 minutes to 6 hours or more. Okay? So on January 20th, I went in for my laparoscopy. And oh gosh, I was super nervous. I didn't know what to expect, but I knew I was ready to move on in my life. You know what I mean? Like, let's figure this out. Let's just definitively find out that it is endometriosis so that we can go on with treatment and we can figure out how to move past this, essentially. Upon going in, he and another lovely, amazing doctor, Dr. Jeff, they opened me up and saw, whoa, my shit was crazy. God damn, y'all. My endometriosis was everywhere. It essentially swallowed up my left ovary. They couldn't even see that, girl. I had lesions all over my uterus, on my fallopian tubes. I had endometriosis on my stomach. I had endometriosis like my intestines, and it just, you know, it was just a shit show, okay? He was not even able to remove any endometriosis during that procedure because it was way more extensive than he anticipated. So he closed me back up and told me, honey, we've got to go further than this because your shit's a mess. Damn. So, ladies, that just meant that my reproductive system was a no-go, honey. It was over with for me. All right. I knew at that moment, at that time, that what I was going to be facing just meant some pretty permanent things for me that I didn't truly want to face at first. Let's take it back.
When I was 15, I was hospitalized for a very bad urinary tract infection, and I was told that I had scar tissue in my uterus and that I wouldn't be able to have children because the eggs would not be able to lodge within my uterus, right? But they didn't do any more research after that. They just kind of sent me and my parents on my way and told me, you know what, figure it out. Well, we just thought, I'm a teenager. Unbeknownst to my parents, it was deeper than that, and we all just thought that because I had so many urinary tract infections due to me drinking a lot of sodas that's what it was. Well, wasn't. Now we know that. Moving forward, 21, 22, I'm a grown-ass woman, and I'm trying to figure out, is something going on with me reproductively because I've had some situations that things should have turned out differently. Things should have went another way, and I'm not sure why it's not happening, what's going on. I've also had, a series of mishaps. Couple of miscarriages, and so I just want to know what's going on, what's happening with me. Okay, figure it out.
So yeah, they told me I needed a full hysterectomy. Okay, full hysterectomy means I would have essentially 4 organs taken out of me. Let's talk about what a full hysterectomy is surgically. Let's get into that. All right, here we go. Let's get into it. An abdominal hysterectomy. According to mayoclinic.org, an abdominal hysterectomy is a surgical procedure that removes your uterus through an incision in your lower abdomen. Your uterus or womb is where a baby grows, and if you're pregnant. A partial hysterectomy removes just the uterus, leaving the cervix intact. A total hysterectomy removes the uterus and the cervix. Okay, so sometimes a hysterectomy includes a removal of one or both ovaries and fallopian tubes. A procedure called a total hysterectomy, that's what I had, y'all. Okay, which is a salpingo-oophorectomy. Salpingo-oophorectomy. Okay, damn. I'm not a doctor, I'm a singer. Okay. A hysterectomy can also be performed through an incision in the vagina, which is a vaginal hysterectomy, that's what I had, or by a laparoscopic or robotic surgical approach, which uses long, thin instruments passed through small abdominal incisions. An abdominal hysterectomy may be recommended over other types of hysterectomies if you have a large uterus, or your doctor wants to check other pelvic organs for signs of disease, or your surgeon feels it's in your best interest to have an abdominal hysterectomy. The day of my surgery, I'm trying to be upbeat. I'm trying to, be positive and really just manifest the best outcome for me. But let me tell you, honey, get out of my mind. Ooh-wee. Woo! Lord have mercy, the nervousness. I don't know why. I just I was fighting negative thoughts. Am I gonna die? Am I gonna wake up? Oh my God, I don't know. I just gotta be honest. I was not the super positive. I was trying to be, but I was scared.
Big day. Ready?
I don't know. I don't got a
Going in.
choice.
going in.
Oh, look.
Everything's gonna work out. Hey, Duck.
Is that a sign? Hi, Ducky. Hi. Oh. Yeah, everything's gonna be all right.
Headed in.
And I was really hurt about what was about to happen, and that my disease had gotten so bad that I wasn't able to do any of the holistic things that you can do, or treatments beforehand. And be mindful, there is no cure for endometriosis, okay? But there are things that you can do along the way to try to help your symptoms and try to get you to be in a position where full hysterectomy is your last and final result, you know, or resort. Resort. I get up, I go in with my wife, you know, I take a couple pics where I'm smiling and I'm just trying to be upbeat and just, you know, be a calm, still voice in my own head. This day was long in the fact that it just felt like eternity to get it started, and it actually wasn't that long, but it just felt like it was. I get back there into the room. They give me meds.
Tell you a little thing about what the whole process is for folks like you and why we're trying to do it and the whole purpose, okay? Okay. So the first thing is, what we try to do not only help you during the surgery, but also after the surgery as well, to decrease the narcotics that we use, okay? So that's what the blocks are about. So what we do is, before the procedure even, Ms. Carly's going to start an IV on, well, she ain't got it yet. So get an IV on you, and then she's going to take you, or we're going to take you into our procedure room, okay? You've heard people having epidurals or seen people having epidurals, very similar to epidural, except the needle in your back, yeah. Instead of needles. Yep. And I put 2 medicines when I get in the right spot. The first medicine is going to make you numb from your belly button all the way down, both legs and everything. That lasts for about 3 hours. And that allows us to use less anesthetic in the operating room. Okay. The second medicine I put in there lasts for about a day. And that allows us to use less narcotics up on the floor. Okay. Once we got you on the other bed, we'll hook you up to a bunch of monitors, use that IV right there to let you go completely off to sleep. Once you're asleep, we're going to help you breathe by putting the breathing tube in. That'll be done after you're asleep. Okay. And then he can do the surgery. It usually lasts about an hour and a half, 2 hours. Once that's done, we'll take the breathing tube out. You'll be in the recovery room with us for about an hour. Then you'll be going up to the floor. Okay.
I have the surgery, and, you know, I'm hoping everything works out. I'm really, really just ready to have them tell me everything is okay and that I'm able to move on with my life. That wasn't the case. That was not the case. Not at all. Not at all. In fact, when I woke up to a wife who's essentially crying and upset.
So, just got done talking to the doctor. My wife's about to be devastated. And I'm trying to pull myself together so that I can be strong for her. Right? So the endo was a lot worse than we thought it was. She's possibly gonna have to have another surgery, which means more downtime. That's devastating for my wife because she's ready to get back to work. She's ready to get back to her career. And we're being held up and stopped right now. At this point, I don't even know what to do, what to say, how to fix it. Just trying to pull it together and be strong for her. Y'all pray for me, please.
When I'm coming to, my wife is taking care of me. She's making sure that I'm good and just kind of not even telling me what had happened. I'm thinking, under heavy sedation, by the way, that I'm fine. I'm cool. Everything's good.
Recovery. I'm officially in a room. Surgery good. Doctor said it was a lot more difficult than he expected. Everything turned out great. Yeah, it's gonna be down for a while. Yeah. She had some additional incisions they had to make. But overall, my wife came through that surgery.
It was kind of unnerving because, you know, when you get things that are unexpected, then it kind of throws you for a loop.
I love you.
Experiences with hospitals didn't know what was going to happen to me that day or next.
The people that come in, although they're supposed to be there, they're still strangers. You're meeting them in a very vulnerable point in your life.
I was very nervous about how it was going to go. What did I need to do to get myself healthy and out of it?
That's it. It hurt. I'm in pain. Yeah, that's to be expected, baby. But I'm glad it's over. I'm glad it's over.
If you're a little bit confused on what's going on, let me bring you up to speed. My gynecologist called in an oncologist. If you're familiar with what an oncologist is, it is a cancer doctor. Now, why did he call him in there? Y'all. Scary. I had to go deeper inside of me to try to investigate what these spots were on my colon and if they are just endometriosis related. That began my journey at the very prestigious West Cancer Center, located in my hometown of Memphis, Tennessee. And honey, I was blessed to be a patient, but baby, not for long.
There you go.
Okay, because I don't got cancer. Period.
Got no choice. Ready to go so they can tell me I don't have cancer.
Exactly. Yes.
That's what I'm ready to hear.
Just realize when we were in your abdomen, there was an area about, you know, I think I told you your bowels, you know, your colon kind of starts here and goes around like this and down. And then we call this part of the colon the rectum. And about that far from where the anus is, there's a spot where there's a circular spot around your colon where it's almost completely obstructed, okay? And then over here where the small bowel and large bowel meet, where your appendix used to be, your appendix is just, I can't see it, and it's all kind of balled up like this, okay? And it's all,
It hurts.
and it's in a, you know, it's kind of all twisted, and then it goes into a little, you know, area, and then there's a firm area there, okay? And so I was gonna get a CAT scan of you and basically look at you from head to toe and kind of see how everything looks, and then get that done. So get some other blood work on it, and you know, just kind of see where they fall as far as some tumor markers. And then you just see the GI doctors, and then come back and just kind of start talking about, you know, if everything's okay from the GI standpoint and the CAT scan standpoint, then, you know, set up a time in the future to do your surgery, okay?
Yeah. So are you concerned with it completely blocking, or is there anything that I could do, you know, to make sure that doesn't happen in between time, or we just got to get this surgery going?
There's nothing that you can physically do to change anything, okay? I'm hoping that with you being on the Femara medicine, that the endometriosis will dry up, okay, and resolve this as an issue, okay, at least from a acute standpoint, okay. You know, could there be more scarring and more narrowing of the bowel? Could be, okay. So I would, you know, I think we talked about being on a more soft diet, or a liquid diet, or mechanically soft diet, or low fiber diet, okay? So I definitely think you need to do that.
When they brought up the word cancer, all I could think was, I want my mama. I want my mama. Cause see, I just thought I was going through endometriosis, and now y'all talking about cancer. And I just want my mama, who had been through endometriosis, had a full hysterectomy right after me, and had gone through a myriad of illnesses, conditions, diseases, and I just felt like there was no one else I could talk to but my mom. And of course I didn't have her. Very scary and unfortunate when you feel like the only person that can help you is not there, and you have to go within. and you don't always have the skills to mother yourself. I haven't physically been anyone's mother, but I've had to mother myself. That's tough.
Okay.
Okay, and you see surgery in about 5 months?
I'd say 6 months. You know, if everything is negative for cancer, okay, I would say at least 6 months, just to see if we can't help. You know, we need to get all this right here that we just did to heal.
So you don't think it's cancer, but there's a possibility.
There's always a possibility. I mean, I never say never, but at the same time, knowing what you had at the time of the surgery, know what it feels like endometriosis in your bowel. But again, I need somebody to look inside your bowel, because by all I'm seeing the outside.
Okay.
I need somebody to look inside the bowel and make sure that the inside doesn't have anything growing through it. And if it does, they can do a biopsy of it.
Okay.
And then from there, tell if it's endometriosis versus something else, which would be bad.
Mm-hmm.
Endometriosis is bad, but it's but we surely don't want you to have cancer.
Yeah.
And I just don't want to miss that or
Right.
they decide to do surgery.
Right.
That makes sense.
Mm-hmm.
So let me get this in.
My colon, they are very concerned about the spots on my colon. So let's get into that. Endometriosis can look like, mirror, and give off the symptoms of colon cancer. And the way that it looks back there is concerning to my doctors because the lesions are pretty big. Now, me and my faith, me and my God, me and that one, the universe, I just do not believe in my heart that I have cancer, okay? I don't accept it. I don't claim it. Even that feels like I still believe. I don't have a belief that I have cancer. My belief is that that's an extended issue of my endometriosis and that my doctors are just being thorough. That's the way I am looking at it. That is what I believe. But thankfully, my doctors are very thorough. They do want to know, for sure that it's not cancer, and that is the road that we're on now. The next step with that is me having a colonoscopy. Now, I cannot have the colonoscopy right now because I have a lot of scar tissue and I have to heal up from the extensive full hysterectomy that went a little bit further than they thought. They are just very concerned with the fact that my scar tissue is so prominent and them not being able to have good vision that they'll nick me. So they're waiting to see if some of the inflammation from just normal surgery stuff goes down and that my healing will clear a path to where they can see and go and do the procedures that will let me know if I don't have cancer. I don't know. I don't know, but I do know. I know, but I don't know. I know, but I do, but I don't, but I can't. You know what I'm saying. And finally, I'll need a bowel resection. Okay? God, I want to die. And it's important that I get this done. Now, my prayer is that I don't have to get this done. I'm praying that God gives me a miracle, because this is a very dangerous procedure. Not only that, the recovery time is just, it's long and extensive. I'll need a colostomy bag for 2 months. Anyway,
bowel resection.
The bowel retraction is where they're going to cut some parts of my bowels and put them back together, and just finger crossed that it jump starts again. I want to say too that adenomyosis is another disease that I was diagnosed with, but we did not find that out until I had the full hysterectomy. That's when you can find out, only when you can find out you have adenomyosis. It is another disease of the uterus. But on the up and up, we are finding solutions. We are talking. We are making this disease and both diseases well known. We ain't playing with this thing, okay? Women, I love you guys. I really hope that this video was informative. I hope that it was something that empowered you and gave you validation if you've been having these symptoms. Because, honey, they try to tell us that we crazy and that these symptoms ain't what they are. They lie, okay? I also want to encourage you to go deeper into endometriosis. This video was real light, okay? It goes deeper. I love you all, Endo warriors. I am here for you. This will not be my only video about endometriosis, but this is not the only content on this channel. For more content on endometriosis, but also singing, because I'm a singer, please check out the rest of the videos. I'll be uploading more and, you know, just trying to become more active on this channel. And I'd love, love, love your support. Thank you so much for staying here with me. It means the world to me. It truly, truly, truly does. I'm signing out. I'm Dottie, and I'll see you guys next time. Much love. Mwah.